When we look at the stomach, one of the chief ailments we see in the stomach is gastric ulcers. Individuals get gastritis, may feel a little upset stomach, oh, I don't feel so hot, blah, blah, blah. Mark it off, check it off as, oh, I ate too much or something I ate. It's not agreeing with me. But usually in a day or so, they're better and they completely forget it. But it's the gastric ulcers, that chronic stomach pain, that burning, all of that, that sticks with patients. What we now know, contrary to what we used to think, we used to think that gastric ulcers were caused by stress, too much caffeine, bad diet, things like that. While they can contribute to the pain, they're not generally what initiates the beginning of the breakdown of the mucus lining and the exposure of the underlying epithelium to the gastric juices. What we now know is that it is generally caused by a bacteria in the genus Helicobacter. Okay, Helicobacter are gram-negative rods. We have urease positive. They make urea. They break down urea as a means to not completely neutralize the acid, but to raise the pH up enough in their little microenvironment so that they can survive. Helicobacter was first identified back in the 79 by Robin Warren, who was looking at biopsies taken from ulcer patients. They would go in for surgery because the ulcers, the pain was too much. They would go in for surgery. The surgeon would excise the area of the ulcer, sew it back up. So that way the ulceration, the wound site would be removed. Stomach would heal given enough time. They identified Helicobacter in pretty much all of the ulcer patients, all of the biopsies that were taken. I say pretty much. I don't want to say all of because I'm not quite sure. I haven't actually read the initial paper. But they had it in their mind that, ulcers, contrary to popular belief, ulcers are caused by bacteria. Nobody would believe them. Until 1985, when Barry J. Marshall, who works with Robin Warren, Marshall took a sample of Helicobacter pylori that was growing in a liquid media, it's in solution, and he drank it. Within a few days, he started to develop the telltale signs of an ulcer, and there you go. Marshall was able to definitively prove a bacteria causes the breakdown, which leads to ulcer formation. And for doing that in, I believe it was 2005, he won the Nobel Prize. So let's step back. Let's go to the beginning here, okay? Gastritis, sharp, burning pain, maybe a bit of heartburn. Gastritis, inflammation of the lining of the stomach. That inflammation over time could impede the mucus production. Remember, the mucus is acting as a protective layer between the gastric juices and the epithelial lining. What happens is that that mucus layer thins out, goes away, and the gastric juices is now exposed directly to the mucosa, the epithelial lining. Those cells get damaged. Those cells start to die. And that wound area starts to get larger and larger in diameter. The gastric juices start to kill cells that, the different layers, and it starts to go deeper and deeper into the tissues. If it gets deep enough, painful enough, you actually could start vomiting blood, or you could start passing blood out in your stool, or the patient blood. We're now looking at gastric ulcers being the precursor to stomach cancer. The gastric ulcer doesn't have to be this big, bad, huge, humongous thing, oh my God, I can't believe I'm throwing up blood type of level. But it's just mere presence there for long enough time, months, years, means an inflammatory response in that given area of the stomach tissues for months and years. And as I've said in many lectures before, prolonged inflammatory response, prolonged inflammation in a given area will lead to rearrangement of the architecture, will lead to damage of the cells in that area. Well, turns out some of that damage could be genetic mutation. And as we know, genetic mutation leading to loss of checkpoint control is ding, 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 cancer. So we're now looking at gastritis leading to gastric ulcers, leading to severe ulcers, leading to stomach cancer. H. pylori, the way it leads, its mechanism for leading to the onset of an ulcer is that the pylori will actually burrow into the underlying mucosa, the epithelial lining of the stomach. Burrows in and attaches and it burrows in. As it burrows in, it's breaking down the mucus lining. It's breaking down the that mucus layer lining the epithelium. Now exposes it to the stomach contents. You'll actually start digesting yourself that way. It's only small little pinpoints. Starts off as little microscopic pinpoints that can over time slowly widen in diameter. They get wide enough, then they start to go deeper. We think H. pylori is spread person to person. Oral, or maybe oral, fecal, oral. Turns out not all the pylori is going to try to penetrate the epithelium. A lot of it's going to be passed out the small intestine, large intestine, out in the feces. So fecal contaminated water, food may introduce H. pylori, oral to oral kissing, or small children slobbering on stuff and back and forth that way. For most of the population, the majority of the population out there, when tested, test positive for H. pylori. The majority of those people testing positive are not going to suffer from ulcers. That's a very small percentage. Now, going back to what we used to teach, stress, caffeine, diet leading to ulcers, they can speed it along. They can alter the stomach environment, which leads to an overgrowth of H. pylori, which can lead to the thinning of the mucus layer, meaning H. pylori can get in, and so forth and so on. If a patient is suffering from gastric ulcers, there are numerous over-the-counter remedies that can offer, at least some relief. Okay, anything to take to help in neutralizing the stomach acid, get that acid level up. You're never going to completely get it up to neutral. You don't want it at neutral. Just want to get it up a bit. Give the stomach, give the tissues a little bit of time to heal. Watch the diet. Cut out the caffeine. Cut out the acidic drinks. You know, go to a nice bland diet for a while, and that should help. Severe cases of gastric ulcers, they are now prescribing antibiotics, clarithromycin, metronidazole. Get rid of the H. pylori, watch the diet, get rid of the stuff that could be aggravating the ulcers, give the stomach its own time to heal.